As a director of breast cancer unit, I'm really deeply involved in the diagnosis of treatment of new breast cancer cases. The landscape of breast cancer are changing dramatically in terms of new treatment coming out.
So every time we see an advance in treatment, we talk about personalised treatment, adding the best treatment for an individual cancer patient based on the biology of their cancer.
MammaTyper is a new lab test that is a step forward in terms of a standard pathology report, standard immunohistochemistry, to the new level of molecular biology.
The biology of cancer hasn't changed over years, it's always been there, but we have now much more powerful tools to understand it and to understand why therapies work.
MammaTyper could help all the system, from the diagnosis, from the neonatologist, to the biologist, to the surgeon, and to the oncologist. We have to think in a multidisciplinary way, and a tool that can help and be used by surgeon, clinician, biologist, and pathologist. All of these be very useful for the whole workflow, for management of the patient.
Women are exposed to so many tests. After receiving the results, they will receive the treatment. This is the first line of diagnosis.
In humankind, every innovation gives you fears. Time is changing. We need a more rapid diagnosis because as soon as you start with treatment, the better will be the outcome of the patient.
Someone think that I have to change my state of mind, I have to change my work. No, you continue to work because you work well, but you can use another tool that can help you to provide more reliable results. MammaTyper could be a useful tool that can be used together with the standard technique.
I think we are going in the right way, but still there is a lot of communication that needs to be done between the industry, the pharmaceutical companies, the oncologist and the pathologist.
Diagnostics are becoming much more important now as we start to target drugs against specific changes in cancers. Now we're getting to the actual tailoring of therapy. We're going to have a much more diverse paradigm for treatment. The MammaTyper test is one small step in that direction. That's how we make progress in cancer.
MammaTyper could provide these results for the patients that cannot be tested for genomic profiling because of the high cost of this test.
We need a strong test. Why? Because if we are able to identify them properly, we are able as a clinician to use properly these drugs. It means saving money and saving lives.
MammaTyper can help to analyze a wide number of markers all together in the same time without waiting for sequential analysis.
I don't know of many simple diagnostic tests that are coming with almost 40 publications that are very affordable. I mean, every hospital can use it.
What happens right now? If a patient is been treated in one town, the same tumors is diagnosed differently in another town.
We do an overdiagnosis and we tend to classify the women in the wrong way.
20% of breast cancer diagnosis in a gray zone. This could affect the life of our women.
The compliance of the patient is much higher when they know that the system is using a reliable methodology. How can you, as a physician, as an oncologist or pathologist, report or treat a patient when you know that you have a technology that in some cases will give you a wrong answer in almost 50% of patients? We have a problem here. We are missing the patient.
We really need a test that could be reliable and could help the pathologist to standardize their reports.
MammaTyper can help the molecular pathology lab to be helpful. A tool that can be useful for better characterizing breast carcinoma and to identify also other subgroup of breast cancer that could be benefit for other treatment or for other management.
The challenge that we're facing is changing, and as those challenges hit the diagnostic laboratory, I think that tests which are much more quantitative will allow us to discriminate groups much more carefully. And the MammaTyper test is one of those tests which assesses the expression of these genes across a broad spectrum. So there are dynamic ranges which we're not tapping at the moment, which we think we're going to have to tap in the future, and that's where tests like MammaTyper will come in.